Welcome back to the Performance Prescription. Matt, we've been doing this. We're starting to get in a rhythm here. I feel like we're starting to get a few episodes under our belt. Any reflections here from some of our other recent episodes before we dive in with Orla?
No, that's a great question, Jared. Thanks for being on again. Thanks for having me. I think the big reflection is just how fun these conversations have been and how much I'm learning and really valuing the input from all of our guests. It's been a heck of a journey so far, and I can't wait to keep going.
Fantastic. All right, well, let's get going with this episode. Do you want to introduce our guest, Orla from Atlantic Health?
Yeah, absolutely. Welcome everyone to Orla Seidel from Atlantic Healthcare, all the way in New Jersey. Orla, thank you so much for joining us. We're really glad to have you here.
Thank you so much. I'm so excited to be here today. Thank you for including me in today's episode.
For sure.
Absolutely. So we can jump right in because I know we have a lot of ground to cover. But Orlo, I would love to hear a little bit about your background. And if I understand correctly, your whole career has not been inside of healthcare. You came from outside of healthcare.
Yeah. Thank you so much, Matt. Yeah. So I'm Director of Digital Marketing for Atlantic Health. We're a leading health system in New Jersey with 8 hospitals, 150 sites of care, 25,000 employees. I am responsible for CRM, performance marketing, paid media, and marketing analytics. I've been with Atlantic Health for about 4 years now, but Matt, you're absolutely right. My background is from outside of healthcare. I spent the first half of my career on the agency side, working for Fortune 500 clients like Lowe's, Staples, CVS. And then I spent the second half working for BlackRock, Bed Bath& and Beyond, and a global medical device manufacturer called Ansell Healthcare. Yeah, I think that experience from outside of healthcare has benefited me in my role in Atlantic Health in two ways. The first, I'd say it has helped me develop a customer centricity that I think often takes a back seat for a lot of healthcare organizations. And secondly, I think it's really given me some deep expertise in leveraging data to prove marketing's impact on business outcomes. So the way that you can harness data and use it to really measure incrementality is something that I don't think happens often enough in healthcare marketing teams.
Yeah, that's awesome. Those are great insights, and we'll hopefully have a chance to dig into both of those today. One of the things when we talked previously, it really stood out to me how much you care about the patient experience. And really, you're putting that care into practice with what you and your team are doing. So, can you tell us a little bit more about how you're using marketing and what your team is doing to impact patient care and patient experience?
Yeah. It means a lot to me, Matt. I talk about the benefits of being from outside of healthcare on my role at Atlantic Health, but the benefits of being in healthcare and what it has done for me as a person are really powerful. I think, for me, I spent my entire career trying to convince people to buy things that they didn't need. And having the opportunity to be here at Atlantic Health and really drive metrics that are so much more important really gives me a reason to wake up every day, gives me a lot more purpose in what I'm doing day to day. I didn't expect it to have as much of an impact on me personally as it did. I'm someone who likes to win. I like to make money. I want to show the numbers. But the first time that I worked on a program for breast cancer awareness, it actually brought me to tears when I saw the impact that we can make on encouraging patients to have their preventive screenings, get their mammograms, and then actually measuring those patient pathways. We saw some patients did have a positive finding, needed a biopsy, and then needed surgery. And you really think about that you can make a true impact on human life. That's something you do not get from the outside of healthcare world. And so it means a lot to me. I think marketing can play a significant role in trying to move patients through that healthcare journey. And I want to be able to prove that with numbers and data. So it's critical. I think with the marketing department at Atlantic Health, we have two primary purposes. The first is to promote our clinical excellence in our priority service lines. It's cardiology, neurology, oncology. So certainly want to build awareness of the great services we have to offer. So in my role, we're doing a lot of traditional media, digital media to try to do that and build that awareness. But the second purpose of marketing is really performance marketing, right? Trying to increase patient acquisition, increase appointment volume. And then once we bring those patients into the funnel, how can we use marketing and communications to really guide them through that journey so that they not only schedule their appointment, but show up for it? Then engage them with their post-appointment communications and make sure that they are retained and engaged throughout the journey, eventually leading to maybe tertiary and patient hospital procedures. And I think when you really look at it and you analyze those interactions that you're having with the patient and you take marketing best practices to hold out control groups and see if you're making an incremental difference, you would be really amazed and kind of humbled by the impact you can drive.
Awesome, awesome. And let's get really practical just for a second, Ola, because we talk to marketing teams all the time, and we help marketing teams bring in new patients and get those appointments set. But you said something about helping people keep those appointments, and then even doing follow-up care after that. So how is your team helping people keep their appointments? Tell us about that communication pathway. What's going on there?
Yeah, thank you so much. I think for the most part, a lot of communication teams are optimizing pre-appointment journeys, right? We streamlined our outreach to patients before their appointment. When I first started at Atlantic Health, we were delivering over 15 touch points before the appointment with different appointment reminders and e-check-in alerts, and it was over communication. So most of the time, as I'm trying to optimize patient journeys, we're pulling back some of that over communication because different teams were unaware that another team was also reaching out, or you have some automated touch points. But one of the stories that I am most excited to share and that I'm really enthused about right now is our pre-appointment journey for colonoscopy. So just in February, we launched Atlantic Health's first AI agents for outbound communication, and we really wanted to solve a very specific need. For colonoscopies, they have the highest cancellation and no-show rate of any same-day surgery procedure. And what that means is patients will schedule their appointment. Marketing hopefully can help them get that preventive care they need, encourage them to schedule their appointment. But once they schedule, colonoscopies have a lower completion percentage than other surgeries or other procedures. And why is that? Because the preparation you have to take leading up to your colonoscopy is complex. It's
Not
different from one
not any
patient to the
fun.
next. And it is not fun. You have to basically commit, a lot of time to some of this preparation, and it is very unpleasant, right? And so patients are sort of confused. If you don't take the right steps in those days leading up to your colonoscopy, you can't have the procedure. If you didn't know you were supposed to stop taking your GLP-1 on a certain day or transition off of solid foods on a certain day, that appointment will draw near and you won't be able to move forward. And for us, those uncompleted colonoscopy appointments are like empty seats on an airplane, right? We don't want those appointment slots to go unfilled. So we really tried to tackle this business problem. We had operational teams proactively calling patients saying, please, do you have any questions about the preparation? Are you going to be ready for your appointment? And spending a lot of time doing that. So we wanted to find a way to help improve the patient experience, answer patients' questions, help prepare them for their colonoscopy, and ultimately have a business impact by reducing those cancellations and no-shows. So for us, we just piloted AI agents for outbound. And the reason that I say we started with the business need is so important to us because everybody's talking about AI. It's the new flashy sort of solution out there. And we didn't want to have a solution to a problem that didn't exist, right? We're not just chasing headlines with. So we really started with this business need and worked with one of our existing partners to build these AI agents to make those phone calls with a virtual assistant out to patients, help inform them about the steps they have to take for their colonoscopy, and ask them if they have any questions. And what's so special about this is that we trained this model only with Atlantic Health's knowledge base. So it doesn't use any information from the internet. If you ask ChatGPT, can I take an Uber home for my colonoscopy? It will say yes. But Atlantic Health says no, for your own safety, we don't want you to take an Uber home, right? So we worked very closely with operational and clinical leadership to build this AI agent just with Atlantic Health's own intelligence so that everything this virtual assistant is saying to you is pre-approved by Atlantic Health. We had 80 FAQs and approved answers to all of these questions, and we ended up having a virtual assistant who could more consistently, reliably, and accurately answer all of these patient questions than really any live person could on the fly or off the cuff. And it could speak in the patient's preferred language, which is so important to us in New Jersey with our very diverse population. So it's meeting this community health benefit. So the whole goal is like, okay, we're going to use these AI agents to contact patients, help make sure that they're prepared for their appointment, and see if they have any questions that we can help answer, right? And we just launched at the end of February. I didn't think patients were really going to engage with these robots, right? I didn't think that they would ask questions. We didn't know if this was going to work. But going back to my point about data, we held out a no-mail control group. So half of the patients who had upcoming colonoscopies are not getting calls from these agents. So we can compare the impact of this agent outreach on patient completion and preparedness for their appointment. And the results have been awesome. We're so excited about what we're seeing. 20% of the patients who answered the phone are actually engaging with the virtual assistant and asking questions, finding they're more likely to ask questions about things that may be personal or embarrassing, and maybe they don't want to ask a live person. And 41% of people are confirming their appointments with the agent, which is really cutting operational burden in half. And because we have these control groups, we're going to be measuring the impact on completion percentage. So that's really just a good example of marketing proving its impact on completed appointments, not just scheduling behavior, but completed appointments. And you can do that by optimizing communication touch points and using technology, automation, and personalization.
That is fantastic. Great results, Orla. And I have to ask, so you mentioned the AI agents being able to utilize someone's preferred language. So what languages are available currently?
Yeah. Well, these LLMs can speak any language. We tested it with Russian. It's very good at kind of translating for you. But because we want a lot of control, we're only doing it in English and Spanish right now. But it has that capability to expand. So if you were to sort of start talking French to it, it will talk French back. But for outbound, when you proactively reach the patients, it's speaking in either English or Spanish. And that's really there's a large patient population for us who would prefer to speak in Spanish. And so just being able to deliver that benefit to patients has been really, really powerful. And, we're monitoring patient sentiment, seeing if patients are getting frustrated. Are they sort of yelling or cursing? We're monitoring the outcomes of these calls. Are we actually logging that, yes, this patient confirmed that they'll show up accurately, looking at call duration. And it just gives you this whole repository of insight into patient communication and conversation that we never had when live agents are talking to you, because we don't listen to every recording and you're not bringing that data together into a single dashboard. So we started with all those FAQs, but now I have new FAQs because I'm seeing what patients are actually asking, right? Like that was a common question we never expected was, do I have to take my dentures out? We never had that on our list of FAQs, but now we can kind of synchronize all of that data and you can really group it together and get categories and topics that you didn't know existed in your patient's mind before.
So you train the agent, so to speak, and then it's an ongoing training that you're making improvements as you go.
Exactly. It's iterative we made sure that all of that detail was really approved clinically, but what makes it true AI is the use of LLM. So it's not just answering questions based on a one-to-one script, right? If the patient says blood thinner instead of anticoagulant, it's understanding intent, but it's also demonstrating
Wow.
empathy, which is just so cool, right? If you say you're stressed, the agent will reassure you and say, this is a great step you're taking for your health. And no, this isn't going to hurt. If you sound frustrated with the experience, it's going to apologize and it's going to try to help walk you through that. If you're joking, we had someone sort of joke, you need to transition to a clear liquid diet. And someone joked, oh, so just vodka. And it knew that that patient was joking and still said no, right? So that LLM component is just really helping us deliver the empathy and human connection that we would want to deliver ourselves as Atlantic Health. So it's the clinical guidance, it's the standardization, the data capture, and then that really human connection that's part of the consumer experience. And for me, I love talking about this story because it's a great example of how marketing can really drive clinical outcomes, reduce operational burden, and have an impact across the system. It's not just about, the billboards and the commercials that we typically see. When you think about healthcare marketing, you can really optimize the patient experience and have real meaningful movement on things like completion percentage, which results in business outcomes for your system.
Again, fantastic story. I agree. And one of the things you've mentioned a couple times already, and this is kind of obvious from this example, you're working across multiple departments within your system to make this happen. So how have you been so successful working across all those departments?
Yeah, but we always refer to this as a four-legged stool, right? You've got marketing, IT, which for us includes data, operations, and clinical teams, right? All four of them really have to work hand in hand for anything to work. If you just want to run ads, you can do that yourself with a creative team and place a media buy. But for us, as we're trying to optimize consumer experience and really try to move the needle on the things that matter to our leadership, you have to work in tandem with your operational clinical teams. And of course, everything you do is in lockstep with data and IT. So for us, colonoscopy, another perfect example. I mean, we didn't just come up with something that we wanted to do because it was Colon Cancer Awareness Month. We wanted to make sure that we're understanding those real business challenges. And so having those partnerships is critical. But another thing that I would like to reinforce to anybody listening, when you think about partnerships with your data team and your operational team, you can't move inventory and generate appointment volume if you don't know where the access is, right? So when I first started, so often somebody would say, "Oh, we have appointment availability. We need more appointments at this particular location or for this particular type of care." And you could start promoting that type of care. But if operationally the templates aren't standardized to accept that new appointment, if the scheduling workflow isn't easy for the consumer, if access truly isn't there, well, you'll have a problem. You won't be able to drive any results. So pick up the phone, try to schedule an appointment and see if they tell you there's a 6-month wait time. And then you'll really be able to figure out, is there true capacity here or not? And operationally, having those workflows, standardizing those scheduling templates, and then having the data team to be able to gain visibility into where the pockets of access really lie, that's so important to any marketing team. You cannot develop a performance marketing engine if you don't know what you're looking to move and where that availability is. So I would not be where I wouldn't even be in this role if it weren't for my partners in operations, data, and technologies. I'm very grateful to all them.
Now, you mentioned data several times, both now and earlier in the conversation. Tell us a little bit more about how you're using data to improve your marketing funnel.
I think this is probably a pain point for most of the people you're talking to. There is no shortage of data in healthcare, but there really is a big challenge in how you standardize and harness it. One of the biggest challenges every healthcare marketer has faced in recent years is the OCR bulletin. You probably hear about this a lot. Is how do you have HIPAA compliant digital analytics on your website? 2023 basically turned everything on its head as we all sort of responded to new guidance from the Department of Health and Human Services. So the first step for us is to really make sure that we have HIPAA compliant digital analytics on our website. So we use a solution for data redaction so that we're not sending PHI and PII together outside of our BAA perimeter. You want to make sure you're tagging everything from a digital marketing perspective. So when it comes to the site, you know exactly where it came from, right? And then we're pushing all of that data into our own EDAP, into our own data warehouse. And we're leveraging a parameter in Epic. Epic is our EMR called link source. And so we're able to tag all of the inbound traffic on our site and really make sure that within Epic, completely compliant, we're able to see if that web activity translated into a scheduled appointment in Epic. And then did that scheduled appointment eventually get completed? Who exactly made that appointment? And then did they have downstream encounters from there? So we're a leader in the nation in terms of using the Epic link source parameter. We're really proud of that. Epic has been expanding its marketing capabilities, and certainly we wanted to be at the forefront of their new enhancements and capabilities. So trying to be a part of that as much as we can. But yeah, I think you have to have digital analytics end to end. You have to be able to capture those end to end conversions from ad to site to your EMR. And then once they see that scheduled appointment, making sure you identify the patient and then seeing what happens after the point that they schedule.
So I think a lot of people were probably just taking notes on that section. You'll probably get some calls and messages
Reach out to
to
me.
get
Reach
more
out to me.
info.
Yeah. Be happy to talk to you.
Well, I do agree that I feel like we could spend a whole second episode just talking about the end-to-end data we were just talking about from link source and things. And I think it's worth just like noting that that's something to be celebrated, that Atlantic was one of the earliest adopters of like link source, of that piece of this puzzle. And it's a triumph, like not just for your health system, but like the industry to say, look, we really can connect a lot of this data more than maybe what we've been led to believe, or just, we're learning how to do it all together. There's always a sense about that, I feel like, in this industry and in this field. And it's another thing just worth celebrating, I feel like. And to that end, you mentioned some of your background and how that has informed, the value you're able to bring here in this particular role. What about earlier days, Orla, as an up and coming marketer prior to healthcare, and any advice you would have given her, or just something to be like, hey, keep an eye on this, or just something that would have come to mind and been helpful a little earlier in your journey as you're looking at where you are today?
I think it's consistent with what benefits me now is really focus on the numbers, right? Really have that commitment to data analytics, because if you can prove the impact of your program, it opens doors to you and it gets you seats at different tables. They'll start coming to you saying, hey, I have this challenge. Can you help me drive it? Because they'll know that you'll put together the measurement plan to prove that you're really able to do what it is that you're looking out to achieve. So, commitment to data, understanding analytics, really making friends with your data and analytics partners so that you're together, at least building requirements. And then once you start building requirements and building dashboards, you become inherently better at analytics and it becomes one of your core skill sets as well.
Orla, I just want to, commend you because obviously your commitment to the data, how in the weeds you are with the analytics. But you said earlier in the conversation, you're starting with the business problem, looking at how to solve that, using the analytics to back that all up. But to me, the most important thing is your commitment and passion for patient care and the positive outcomes, because you're not just the business problem isn't the appointment, it's the completed appointment and the positive business outcomes. So being able to put all of that together in one package is very, very unique and very, very helpful. So thank you so much for sharing all of this.
Thank you so much. And I think, we as patients, right? We're all patients in our personal lives. We know that the healthcare experience has a lot of challenges. There's a lot of room for improvement. And I think tying it back to data yet again, if you can tap into your PX data to really understand where those patient nuances are, hopefully those patient challenges are also your business challenges, right? Because together your organization should be trying to alleviate some of those hurdles that patients are just facing every day. If you do that, you can really boost preference and choice for your health system and the type of care that you have to offer, and then you can build long-term patient loyalty. So it all does come back to the data, whether it's business data or patient experience data. Really tap into understanding what those problems are and then try to solve them.
Another just thing I think to be celebrated is, or what I'm hearing is just such an experienced like comfort level with AI. And I feel like that's important to point out too, is the level that a leader in this field is at these days of like, we're so far past, oh, I think I'm just going to tinker with this, or I'm not sure. Like the comfort level is important to be able to just move forward and say, yeah, like here's our process. Here are some wins. Here are places we've learned, or here's places we're still learning. So just wanted to call that out too, because I definitely heard that a lot in the story, and it definitely is part of, I would say, how it's contributing to the results you're seeing, and the contribution you're able to see with your marketing.
It's that partnership again, right? The safeguards that we have for AI really are from the AI governance committee that's led by our IT team, right? It's partnership with legal and compliance. So we've built the framework for experimentation within our guidelines and what's acceptable to us as Atlantic Health. And we're able to document everything that we're doing and really go through a lot of rigorous reviews and approvals and be cautious, but be fast. We want to be reactive to what can help benefit our patients and help drive business results. So when you have the right safeguards in place, you can have a high level of confidence with your experimentation and your piloting, and you'll be able to proceed very, very confidently.
Awesome. Orla, again, thank you very, very much for your time. I'm really looking forward to seeing what you and your team continue to do at Atlantic Health.
Thanks for joining us, Orla, and giving us so much to think about here along this journey.
Thank you so much. Thank you, Matt. Thank you, Jared, for this opportunity. It was great talking to you.